The last decade has seen the emergence of India on the global map. But in the shadow of a shining India lies Bharat, a land plagued with diseases. Millions of Indians living in villages still don't have access to even basic healthcare facilities. And if India has to emerge as a superpower in all senses of the term, then it's essential that these challenges are addressed soon. So Kiran Mazumdar-Shaw, one of the leading names of the healthcare industry, sets out to find the solutions with a very special guest today.
Hello and welcome to India's Healthcare Challenge with me, Kiran Mazumdar-Shaw. My guest today is the very well-known Dr. Naresh Trehan, a great entrepreneur, a great surgeon who has created his own enterprise, Medanta Health City. Over the next 30 minutes, I will be speaking with Naresh and sharing some thoughts on how we can build a great healthcare system for our country. Naresh, thanks so much for coming on the show. And
my pleasure, no problem. Yeah.
Let me start by talking about the huge challenge we face in healthcare. Just starting with hospital infrastructure and hospital beds. We know that there is an estimate and a forecast given that we are short of 2 million hospital beds, and to build these 2 million hospital beds over the next 5 years, it's going to cost us $80 billion. I mean, those are the kind of numbers being thrown at us. We also know that 50% of hospital beds are in the private sector, and that private sector is actually spending almost 80% of every incremental dollar invested in the healthcare sector.
That's true. Mm.
So having said that, it almost seems to sort of point at a picture where India's healthcare space will be sort of supported by the private sector, and yet there are many people who are very worried about that happening, because they feel if that were to happen, then healthcare is going to be expensive, and how are we going to build an affordable healthcare model if we have to depend so largely on the private sector?
First, in India, why the burden of disease is so heavy at the ground level, at the rural level, at every level, is because the basics of health are missing. So you don't, the whole story of no clean drinking water, sewage system, garbage disposal, mosquito control, education. These are the 5 pillars of a healthy country. So if we were to take our attention a little bit to that part of life also, and we just made sure in the next 5 years that every village had clean drinking water and had a sewage system and had proper mosquito control and education system.
So preventative health, it's almost that, yeah.
It will decrease the disease burden by 50% at that level, okay? And that is where the investment is the least and the return is the highest. Of course, this has to be done by the government. Private sector can help, and the civil society can help. Then comes, what are the needs where 75% of India lives? What are the needs of a village? The needs of a village is that, one, their daily disease pattern should be taken care of, so that if you get, say, dengue or malaria or cholera, whatever you're getting in the current environment, it does not lead to serious consequences. That means the diagnosis must be correct and early. I've been doing some study, and I've created a model in a district. It's a theoretical model which we are going to work now on, is to say, take a district. So we took Sonipat district. Sonipat district has a population of 22 lakhs. It has got 4 civil hospitals that belong to the government of Haryana. Each one of them is no more than 60 kilometers away from each other. If we took mobile systems and we attached them to these hospitals, which are in C-grade cities, where doctors and their families can very easily, safely live and go to have schooling and other facilities, then we take mobile systems which cover all this whole radius of 30 to 60 kilometers around them. It will take no more than 4 to 6 units per hospital. 4 to 6 doctors, 12 nurses, 12 technicians to be able to run So that what you are doing with the government's ASHA scheme, with the cell phone availability everywhere, the mobile system goes, the patients are collected in one area, they are checked, treated. You must have ability to diagnose some of these things or take the blood back to the center and take the whether dengue serum and all that has to be done. Within 24 hours you have the diagnosis. If somebody has the problem, you send an ambulance and bring them to the district hospital. So you leave the primary and secondary care combined in one program at the state level, assisted by PPP models or NGO sector, wherever help can come. Then comes the tertiary care, which is the main challenge that we have in this country. This is where private sector can actually, if their intention was right, we can come up with workable solutions.
You know, you and Devi Shetty are both very, you're champions of health cities, the concept of health cities, which is really about, delivering healthcare for large numbers, for the masses, and therefore that's what sort of has inbuilt affordability in it.
Correct. So that's the model, that if you spread the cost over a larger base, you can offer it the highest quality at a reasonable cost. So that's basically, these are the models which we can keep refining.
In this special series, we aim to find out what it will take to build an all-inclusive healthcare system. And Dr. Trehan believes that the solution lies in developing a public-private model where the government should focus on providing primary healthcare. And this can be augured by private players providing high-end tertiary care. While Dr. Naresh Trehan is one of India's most famous cardiovascular surgeons, and over the past 2 decades, his efforts have saved hundreds of lives. But in his new avatar as an entrepreneur, Dr. Trehan is championing the cause of providing affordable and accessible healthcare in India. But the sheer numbers make it a daunting task, and he feels that the solution lies in combining modern-day medicine with traditional systems of cure.
Today, I think, by and large, the public sector hospitals are under-resourced. Whatever
and overloaded, might say, and overloaded. Yeah, because they are doing a great job, no question. If you take institutions like All India Institute and Safdarjung and all these institutions, PGI, the quality is very good, but they are so swamped with the load because the other facilities are not available. So I'm saying that because if we segment this sector and true to form try to solve the full chain from the bottom up, we can have a robust healthcare system as we know it today in the next 5 to 10 years. But there is a very important element here which I would like to add. What we are doing today is we are copying the West in the practice of modern medicine. Personally, I believe, and that's Vedanta, the Medicity's message, the whole purpose of building it was to not only practice the highest end of medicine that is practiced anywhere in the world at affordable cost, but in progressively trying to bring in our traditional medicine, other forms of therapies, so that 3 things can be accomplished. One is that we can accomplish the same endpoints or outcomes as modern medicine or even better. We can do it with less pain and invasion of the body, and it should be imminently less costly, hopefully half the cost.
No, which brings me to another question. There are 2 aspects to all this. One is you're almost talking about our own version of personalized medicine.
Right,
okay?
Absolutely.
The other aspect is, we all know that to really sort of bring in affordability into any system, you need standardization.
Correct.
So one of the things that we also have to address is standard of care, and that's something else I think we need to work on in the healthcare system to see how we can sort of
no question. What you are saying is, see, this is exactly what has to happen, that when you say that we need standardization